Elessar is an AI field medic voice agent. Through a live conversation with the user, Elessar is able to diagnose and administer treatment instructions for around 30 different traumas, injuries, and illnesses. Administering first aid care is a time-sensitive and precise process that not many people are familiar with. Elessar leverages the convenience of a conversational interface to enable anyone to give first aid assistance on site. Now, before I get into the how it works, I'm going to do a quick demo. All right, so now imagine you've just walked into your house and you found your roommate unconscious on the floor. And I'm gonna use the web app, but you can imagine having this pulled up on your phone. Help, my roommate's unconscious on the floor.
Can you tell me if your roommate is breathing or showing any signs of movement?
Yeah, they're showing some signs of movement.
Can you describe the type of movement you're seeing? Is it uncontrolled body movements or just slight movements? Also, is the patient conscious or unconscious?
They're now conscious and said that they were really dizzy before they passed out.
Did the patient experience any other symptoms before or after passing out, such as chest pain, trouble breathing, or any unusual sensations in their body?
They said they had some vision problems and kind of hot skin.
Can you tell me if the patient is experiencing any difficulty speaking or confusion?
Yeah, they're somewhat confused.
Can you tell me if the patient is experiencing any physical symptoms like weakness, numbness, or changes in their speech?
Yes, they're experiencing all of those.
I have determined that the patient is likely experiencing a stroke. This is a medical emergency that requires immediate attention. Please call 911 right away. While waiting for emergency services, follow these steps. 1. Note the time when symptoms started. Second, keep the person calm and comfortable. 3. Place them in the recovery position if necessary. Continue to monitor the patient until help arrives.
All right, and so that gives you a sense of how LSR goes about diagnosing and then giving treatment instructions for a given patient. Okay, so here we can see this conversation play out, where the user is asking or saying things to the agent, and the agent is responding with questions to try and narrow down its list of diagnosis and does that continually until it reaches a final diagnosis and returns the treatment as well. So how does it work? Elessar takes in computer audio and transcribes it using DeepGram's speech-to-text model. That text then gets sent to Palantir's AI to our diagnosis agent that we built in Palantir's AIP. That agent takes in a query, conversation history, and any previous diagnoses if they exist. It then uses the querying tool to query the list of conditions, or data set of conditions, and update its diagnosis. If there are still multiple conditions to consider, it outputs a question. Oh, sorry, that's up here. It generates a question to help it narrow down its diagnosis. Otherwise, it outputs it informs the user of the diagnosis and outputs the steps for treatment.